Welcome to our 12th module, Congestive Heart Failure, from Chapter 9 of Unit 3. This course has been designed to be a review course to help prepare you to take the CRC, the Certified Risk Coder Certification exam from the OPC. Hello everyone. I'm Emily. Today we will be discussing congestive heart failure. As a coder, it is important for you to understand the concepts and relationships among diseases, their progressions and related comorbidities. By the end of this module, you will be able to define congestive heart failure, ascertain how to document congestive heart failure, determine the ICD-10 codes for the documentation of congestive heart failure. Congestive heart failure, or CHF, is a clinical syndrome in which the heart is not able to pump enough blood to meet the needs of oxygen and nutrients for the tissues in the body. It usually occurs when the heart muscle is too weak. Other defects can also cause it to stop working properly by preventing the blood from circulating. It is broadly categorized into two types: left-sided CHF and right-sided CHF. Left-sided CHF is more common. It occurs when the left ventricle of the body is unable to pump blood effectively to the rest of the body. When this happens, the normal functioning of the other body organs hinders, which causes fluid to build up in the lungs, resulting in abnormal breathing. We can further subdivide it into systolic heart failure and diastolic heart failure. In systolic heart failure, the left ventricle cannot contract normally, thus limiting the heart's ability to pump blood to the other parts of the body. In diastolic heart failure, on the other hand, the muscles present in the left ventricle stiffen. Because it can no longer relax, the heart cannot fill with blood between the beats.
I see. What about right-sided CHF?
Right-sided CHF occurs when the right ventricle is unable to pump blood to the body effectively. It is less common than left-sided CHF. However, there is a possibility that both right-sided CHF and left-sided CHF occur at the same time. But even in that case, congestive heart failure starts with the left ventricle. Any health condition that directly affects our cardiovascular system can be a potential cause of congestive heart failure. Hypertension, coronary artery disease, conditions related to the irregular opening of the heart valves, diabetes, thyroid diseases and certain infections may lead to congested heart failure. Initially, the symptoms include fatigue, swelling of the limbs, weight gain, and an increased need to urinate. In the later stages, irregular heartbeat, rapid breathing, chest pain, wheezing and fainting might occur. In children, poor feeding and excessive sweating are also considered as symptoms of CHF. Congestive heart failure can be categorized into 4 broad stages. Hover on the stages to learn more about them. When it comes to the coding of congestive heart failure, we use the code category I50. You should also keep in mind some of the additional codes which are used to identify related factors.
What are these additional codes?
Here is a list of the additional codes. Heart failure complicating abortion or ectopic or molar pregnancy, 000007, 008.8. Heart failure due to hypertension, I11.0. Heart failure due to hypertension with chronic kidney disease, I13. Heart failure following surgery, I97.13. Obstetric surgery and procedures, O75.4. Rheumatic heart failure, I09.81. There is one important point to note for the coding of heart failure. Do not assign the code I50.9 heart failure, unspecified, for a patient with stage A heart failure.
Oh, why so?
According to the American College of Cardiology and the American Heart Association, a patient with stage A heart failure is at a risk to develop the condition. However, that doesn't necessarily mean that the patient has heart failure. Stage A heart failure, as defined by the American Heart Association, is the presence of heart failure risk factors but no heart disease and no symptoms.
Which code should we use in this case?
We should assign the code Z91.89 Other Specified Personal Risk Factors, not elsewhere classified. Remember, this is very important, as an improper code can lead to the diagnosis of a heart attack. Now let us look at the code examples for heart failure. Click here to view the code examples of congestive heart failure. That brings us to the end of our 12th module, Congestive Heart Failure. In this module, we defined congestive heart failure, ascertained the documentation of CHF and noted the ICD-10 codes used for congestive heart failure.